for everyone, at least in West Virginia and I guess across the country, all lives are essential. Everyone's valuable to us. So if you want the vaccine, we're ready to give it to you when it's available. So I hope you want it, and we'll be ready for you. Thanks.
Howard?
So thank you again, Caroline, for leading us in a great discussion today. I want to conclude by saying that before I moved into public health at the state and federal level, I had the honor of caring for patients for many, many years. And what I learned from them is that when a loved one dies, that's a tragedy. But when a loved one dies and you know that death could have been prevented, that tragedy haunts you forever. And right now, millions of people around the country and around the world are wrestling with that. So I'm hoping that with that as a backdrop, we can now look forward to revitalizing and sustaining public health and disease prevention going forward so that this tragedy never happens again.
So I would just say that it's been an incredible partnership and collaboration from the federal to the state level and at the state level with all of our community partners in our counties and our local communities. And that has been the amazing thing about this for me. And I have to agree with Howard, and that is that a year ago, I wouldn't even have put a lot of money on the fact that we would have had a vaccine, let alone 3 vaccines that are this efficacious and this safe. And so it is heartbreaking if, as we continue to lose Americans around the state and individuals all over the world from this disease. And I really hope that everyone will look and listen closely as their communities educate them about this vaccine and decide to take it.
Thank you. Mike?
These are all great takeaways. And I think I'd just add by really sharing my appreciation for all the work that our members are doing at the state level and with our partners federally and locally, as well as so many partners in academia and other organizations that are supporting this response. This has been a long year. And then as an advocate for public health, I really, there was a hearing that was held a couple of weeks ago, at which Tom Cole from Oklahoma said, sometimes you got to spend billions to save trillions. And, with hindsight being 2020 and all that we knew about our public health system leading up to this COVID-19 pandemic, we could have saved a lot of lives and certainly a lot of dollars if we had a robust public health infrastructure. And shame on us if we don't use this opportunity to really build that for the future. And I think we are. Thanks,
Mike. And Nirav, we have time for you to be the last takeaway.
Well, that's very thoughtful. And again, my thanks for everyone for coming together today and convening. I'll end on this note. For the past year and a half almost, the American people have seen what state public health does in action and what we can do when the chips are down and when we are called upon by our constituents to help out. This is what we do. And now, given the funding that's been made available, we have before us the task of thinking about what the next phase of public health looks like in this country. As Mike said, this is our time to build on the successes and then re-envision what the future of public health will be.